Did you know that more than 320 million men worldwide are expected to suffer from erectile dysfunction by the year 2025? And yet, when most people hear about Tadalafil, they imagine it's as simple as popping a pill and waiting for the magic to happen. But is that really true? Today, we're going to uncover the truth behind Tadalafil, how it really works inside your body, why timing and stimulation matter more than you think, and the mistakes that could make it completely ineffective or even dangerous. And here's the twist. Towards the end of this video, I'll reveal a little-known strategy that can make Tadalafil work up to 40% more effectively, something most men and even some doctors never tell you. So make sure you stay with me until that part, because it could completely change your results. This isn't just about performance. This is about confidence, health, relationships, and quality of life. If you've ever wondered whether Tadalafil is right for you, or if you're already using it but not getting the results you expected, this video could be the turning point. Let's dive in. Most people think Tadalafil is just a magic switch for erections. But in reality, it works through a very specific pathway in your body. To understand this, let's simplify the science. When a man becomes aroused, the brain sends signals that release nitric oxide in the blood vessels of the penis. This nitric oxide increases a chemical called cGMP, which relaxes the smooth muscles and allows blood to flow in. That's what causes an erection. Now here's the problem. Another enzyme called PDE5 breaks down cGMP too quickly. For men with erectile dysfunction, this means the erection either doesn't happen at all or disappears too soon. And this is where Tadalafil comes in. Tadalafil blocks PDE5, allowing cGMP to stay active longer. The result? More sustained blood flow and stronger erections. But here's the catch. Tadalafil does not create sexual desire. Without arousal, the pill alone won't do much. Think of it this way. Tadalafil is like an amplifier, not the instrument itself. If there's no music playing, there's nothing to amplify. In the next chapter, we'll break down one of the most common questions. How long does it actually take to kick in, and why does timing matter so much? One of the biggest misconceptions is that Tadalafil works instantly, like flipping a light switch. But the reality is very different. After swallowing the pill, Tadalafil needs to be absorbed through the digestive system, processed by the liver, and then carried into the bloodstream. This process takes time. On average, most men begin to feel the effects between 30 minutes to 2 hours after taking it. Now, here's where it gets interesting. Unlike other medications in the same category, Tadalafil has a much longer half-life, around 17 hours. That means the drug stays in your system for up to 36 hours. No wonder it's often called the weekend pill. You don't have to worry about strict timing like with some other pills. But timing is not just about when you take it. It's also about what you eat and drink. A heavy fatty meal can delay absorption significantly. So if you take Tadalafil right after a big steak dinner, don't be surprised if the effects are slower or weaker. And here's a tip most men don't realize. Because of its long action, Tadalafil can actually work better when taken consistently, not just when you expect intimacy. We'll dive deeper into that in Chapter 4. But before that, we need to address one of the most confusing myths. Does Tadalafil really work if you're not aroused, or is that just marketing hype? That's coming up in Chapter 3. Here's where many men get frustrated. They take Tadalafil, sit back, and wait, but nothing happens. And that's because they've misunderstood how the drug works. Tadalafil doesn't create sexual arousal. It only helps the body respond when arousal is already present. Remember the nitric oxide and cGMP pathway from Chapter 1? That entire chain reaction starts with sexual stimulation, whether physical or mental. Think of it this way. Tadalafil is like opening the floodgates of a dam, but if there's no river flowing in, the gates won't matter. Without arousal, there's nothing for Tadalafil to enhance. This explains why some men think, the pill didn't work for me. In many cases, the pill was doing its job, but the missing piece was mental or emotional stimulation. Stress, anxiety, or distraction can completely shut down the process, even with the medication in your system. In fact, clinical studies show that up to 25% of men who believe the drug failed actually weren't adequately aroused during the test. That means the pill itself wasn't the problem. Now, this leads us to an important question. Should you take Tadalafil only before intimacy, or could daily use be more effective? That's exactly what we'll uncover in Chapter 4. Most men are prescribed Tadalafil on demand, meaning they take it only when they expect intimacy. But did you know that Tadalafil is also approved for daily use at lower doses? Let's compare both approaches. On-demand use, typically taken in doses of 10 to 20 milliliters, works best when taken at least 30 minutes before activity, offers flexibility for men who don't need it every day. Daily use, usually 2.5 to 5 milligrams once a day, keeps a steady level of the medication in your system, removes the need to plan ahead, which can reduce performance anxiety. Interestingly, daily use has also been shown to improve symptoms of benign prostatic hyperplasia, BPH, an enlarged prostate that affects urination. So, which is better? It depends on your lifestyle and medical condition. For men who want spontaneity and less pressure, daily dosing often feels more natural. For others, on-demand works perfectly fine. But here's something few people talk about. Men on daily Tadalafil sometimes report stronger and more reliable erections compared to those who take it occasionally. Why? Because the drug builds up a consistent baseline in the body. In the next chapter, we'll cover something critical. Who should avoid Tadalafil completely, and what risk factors make it dangerous? Now, this part is critical because Tadalafil is not for everyone. While it can be life-changing for many men, for others it can be extremely dangerous. Who should avoid it? Men taking nitrates. Nitrate medications, often prescribed for chest pain or heart disease, combined with Tadalafil, can cause a sudden and dangerous drop in blood pressure. This can be life-threatening. Severe heart conditions. If you've had a recent heart attack, severe arrhythmias, or uncontrolled blood pressure, Tadalafil may put too much strain on the cardiovascular system. Severe liver or kidney disease. Since Tadalafil is processed in the liver and excreted through the kidneys, serious impairment can lead to toxic accumulation in the body. Men with certain eye problems, rare but important. Conditions like NAIN, a type of optic nerve damage, can worsen with PDE5 inhibitors. Low blood pressure or uncontrolled hypertension. The vasodilation effects of Tadalafil can make these conditions worse. Even for men who don't fall into these categories, a doctor's evaluation is essential before starting. Too many people think of Tadalafil as just a lifestyle pill, forgetting that it's a prescription drug that directly affects the cardiovascular system. And speaking of risks, in the next chapter we'll look at something every man should know, the side effects you shouldn't ignore, and how to tell the difference between mild and dangerous ones. Like any medication, Tadalafil comes with potential side effects. Most are mild and temporary, but some can be serious, even life-threatening, if ignored. The common, usually mild side effects: headache, indigestion, or stomach discomfort, back pain or muscle aches, flushing, a warm, red face, stuffy or runny nose. These usually fade within a few hours. But let's talk about the red flags, the ones that mean you should seek medical attention immediately. The red flags: sudden vision or hearing loss, rare, but reported. This could be linked to reduced blood flow to the optic or auditory nerve. Severe chest pain or dizziness. This may signal cardiovascular stress, especially if combined with other medications. Priapism, an erection lasting more than 4 hours. This is a medical emergency. Untreated, it can cause permanent damage to erectile tissue. Allergic reactions, swelling of the face, tongue, or throat, or difficulty breathing, though extremely rare, requires urgent care. Here's the key. Most men tolerate Tadalafil very well, but ignoring the warning signs is dangerous. Think of it as driving a high-performance car, smooth when handled properly, but risky if you ignore the gauges. In the next chapter, we'll uncover something that shocks many patients: the biggest mistakes men make when using Tadalafil, and how those mistakes ruin their results. Even though Tadalafil is highly effective, many men sabotage their own results without realizing it. Let's look at the most common and costly mistakes. 1. Taking it right after a heavy fatty meal. This slows down absorption dramatically. Instead of kicking in within an hour, it may take several hours or feel weaker. 2. Mixing with alcohol. A couple of drinks might be fine, but excessive alcohol can not only reduce the effect of the drug, but also increase the risk of side effects like dizziness, headaches, and even fainting. 3. Skipping arousal. As we covered earlier, Tadalafil does not create desire. Some men take the pill, wait, and then assume it failed. In reality, they didn't provide the necessary stimulation. 4. Self-adjusting the dose. Taking more than prescribed does not guarantee better results. It only increases risks. On the other hand, taking too little may leave the drug ineffective. 5. Ignoring underlying health issues. Erectile dysfunction is often a symptom, not just the problem itself. It can be an early warning sign of cardiovascular disease, diabetes, or hormonal imbalances. Using Tadalafil as a band-aid without addressing the root cause is a mistake. 6. Mixing with nitrates or recreational drugs. This is not just a mistake, it's potentially deadly. The blood pressure crash can be severe. These errors often explain why some men say, "It didn't work for me." In truth, the drug works, but the approach was wrong. Which brings us to the final and perhaps most powerful chapter, the secrets to making Tadalafil work even better, safely and effectively. Tadalafil is effective on its own, but there are proven ways to maximize its benefits and make results more consistent. Let's explore them. 1. Time it strategically. Even though Tadalafil can last up to 36 hours, taking it on an empty stomach, or at least away from heavy meals, helps it absorb faster and work more reliably. 2. Maintain a healthy lifestyle. Regular exercise improves circulation, which directly enhances Tadalafil's effect. Studies show men who combine PDE5 inhibitors with lifestyle changes report better results than those who rely on the pill alone. 3. Manage stress and anxiety. Mental state plays a huge role in performance. Practicing relaxation techniques, mindfulness, or even therapy can boost Tadalafil's effectiveness significantly. 4. Consider daily low-dose use. For men with frequent intimacy or those who want spontaneity, daily Tadalafil at 2.55 mg can create a steady baseline, reducing pressure and performance anxiety. 5. Watch what you eat and drink. Avoid excessive alcohol and limit very fatty meals around the time of taking the pill. Also, hydration matters. Proper fluid balance supports healthy circulation. 6. Address underlying health problems. Remember, erectile dysfunction is often a symptom. Controlling blood pressure, blood sugar, and cholesterol doesn't just improve erections, it protects your life. 7. Communicate with your partner. Many men underestimate this. Intimacy is not just physical, it's emotional. Confidence and connection can dramatically amplify the effectiveness of Tadalafil. Here's the secret that most people miss. Tadalafil is not just about stronger erections. It's about building a healthier, more confident version of yourself. When used correctly and combined with the right lifestyle, it can become part of a long-term strategy for vitality and well-being. But before we wrap up, let's bring everything together in a clear conclusion with practical takeaways. So, let's bring everything together. Tadalafil is not just a quick fix. It's a scientifically designed medication that works by enhancing your body's natural response to arousal. We learned that it doesn't work instantly. Timing and absorption matter. Arousal is essential. No stimulation, no results. Daily use can be just as effective as on-demand use, depending on lifestyle. Certain men must avoid it due to dangerous interactions. Side effects are usually mild, but the red flags should never be ignored. Most failures happen because of mistakes like heavy meals, alcohol, or skipping arousal. And finally, lifestyle, health, and communication are the keys to making Tadalafil work even better. But here's the bigger picture. Erectile dysfunction isn't just about performance in the bedroom. It can be an early warning sign of more serious health issues like heart disease, diabetes, or hormonal imbalance. In other words, Tadalafil may help you in the moment, but it's also your body's way of telling you to take your health seriously. So my advice? Don't just rely on the pill. Use it as a tool, but also work on your fitness, diet, stress, and medical checkups. That's how you'll achieve not only better performance, but also a longer, healthier life. Now, I want to hear from you. Have you or someone you know ever had an experience, good or bad, with Tadalafil? Share it in the comments. Your story might help someone else. If you found this video useful, don't forget to like, subscribe, and share it with someone who could benefit. Take care of your health, take care of your confidence, and I'll see you in the next video.